The government sought to clarify the new tax policy. The opposition expresses its concerns and a goal set for year-end for vaccinations. Good evening, everyone. I'm Leah Cooper with your JCN News for this Thursday, October 28th. Minister of Economic Affairs Michael Halkitis this morning explains why VAT will be 10% straight across the board. This explanation follows a communication in Parliament yesterday by Prime Minister Philip Davis, who noted the reduction in value-added tax will help Bahamians and the economy. He also shared that the reduction will be straight across the board, including breadbasket items and medical items, which are now VAT-free.
We believe that the savings that the consumer will get on all the other items other than the VAT-free items will more than make up for any additional costs related to VAT being put on those items. And of course, the Prime Minister mentioned the role of price control in his presentation in ensuring that consumers are not unduly exploited. I want to say that our advice has always been from the implementation of VAT, and it is universally accepted as the best practice that the most efficient and the best system of VAT is to maintain a single rate with minimal exemptions, and if assistance is required to the unemployed, the poor, low-income earners, that you give that assistance with direct cash transfers.
Now, this announcement also comes off the heels of a looming 8% grocery price increase. VAT was 7.5% when it was originally introduced by the Christie administration in 2015, and it was increased in 2018 by 12% by the Minnis administration.
The Department of Statistics, they do a study called the Household Expenditure Survey, and they say the people at the lowest income level spend about 25% of their income, or their spending is spent on food. So 75% goes on something else. So the 75% that goes on something else that's valuable, they're going down from 12 to 10. From the items that were on the bread baskets and were other zero rated, now there'll be a 10% VAT. But what we're saying is, we understand it's an emotional issue. Now, we know that it gets to be a very hot political issue, but our job is to do what we think it's in the best interest of the country.
Value-added tax will be decreased from 12% to 10% no later than January 1st, 2022. The reduction of VAT was a key campaign promise of the Progressive Liberal Party on the campaign trail. Asked what happens beyond the 1 year that was noted in the party's Blueprint for Change plan, Minister Halkitis says this.
What our thinking was that you put it in and you'll see how it works. We believe that you can reduce it if you concentrate, and we've already started our efforts in terms of, you've heard us speak about the Revenue Enhancement Unit and bringing in that unit to make sure that other taxes that are owed to the government, we can collect them. We've already begun that work. We feel fairly optimistic, well, I should say very optimistic, but you always want to be cautious when you're dealing with COVID. We feel optimistic about the economy. We see a good demand. We see, some activity due to the opening up. And so we believe that we can exist with a 10, with a growing economy, improved revenue administration. All right.
That said, St. Barnabas MP Shannon Cartwright issuing a statement this afternoon regarding the government's intention to add VAT to breadbasket items. He labels that decision as a paralyzing burden on the backs of Bahamians struggling to make ends meet. He says to take away this much-needed relief directly from Bahamian consumers would only increase hardships and force undue pressure on an already challenged social service safety net. Mr. Cartwright says while the government looks to make up its revenue shortfall with its new proposed tax policy, it ought not be done at the expense of the undeserved, the disenfranchised, and those Bahamians that need relief the most. Back in 2018, the Minnis administration eliminated VAT on breadbasket items, a move described by Mr. Cartwright as an attempt to ease the tax burden on the Bahamian people. The government's eyeing a 40% vaccination rate by the end of the year. This coming from Health and Wellness Minister Dr. Michael Darville. He says this figures based on the goals set by the World Health Organization for countries across the globe.
We are close to 40 now, and I think that we would surpass that. thanks to the efforts of our vaccination committee and all the professionals and volunteers who are part of that.
Dr. Darville also noted that vaccinations are going well in the Family Islands, and he says that's because the clinics are now responsible for the vaccinations supervised by the National COVID-19 Vaccine Consultative Committee.
And then we got our tranche of 57,000 doses of Pfizer. That is proving to be very beneficial on the ground, and Bahamians are coming because they understand that those who end up in hospital who are COVID positive are usually those who are unvaccinated. And the incidence of death is also higher in those who are unvaccinated. And I think that message is going out. We have a lot more work to do. And with our communication task force, we will begin now to get our message out fully throughout the country, the need to be vaccinated.
Dr. Darville adds that the government's also considering having private clinics and hospitals start to administer the COVID-19 vaccines.
When I spoke to the vaccination committee on coming to office, they tried. And because of the workload and the fact that these services are usually provided free of charge, the paperwork that follows, because when you vaccinate and when you test, it's important for you to report, because without reporting, you will not be able to follow up what's going on in the country. And so we are going to move to the next step where doctors, where other facilities have the ability to vaccines and to be able to vaccinate, particularly on the Family Islands, where we know that the healthcare infrastructure is not at the level of New Providence, and people still need to be vaccinated. And so private physicians in the outskirts Family Islands should have access to vaccines to assist in vaccinating their patients.
At least 127,567 Bahamians and residents are fully vaccinated. Health officials confirmed 45 cases of COVID-19 over the past 2 days, 23 confirmed for Tuesday, October 26th, and 22 confirmed for Wednesday, October 27th. 38 confirmed here in the capital, 3 on Grand Bahama, 2 on Eleuthera, 1 on Inagua, and 1 with the location pending. Total cases confirmed in country now stand at 22,351, 441 of which are active. 67 patients are in hospital at this time, 62 of which are considered moderately ill, while 5 battle the virus in intensive care. 14 recoveries were also reported, pushing total recoveries to 21,079. The death toll remains at 643. You're watching JCN News. Stay with us.